Hello, if you've got a gum infection, please watch this video because it's probably one of the most important videos that you're going to watch on the subject. And in case you're thinking, well, what does he know about gum infections? Let me show you this. Yeah, I do know a little bit about what can happen to your teeth with gum infection. But that isn't what it seems. Let me tell you my story. My name's Joe Johnson. I've been researching into natural remedies for over 25 years, and it was about 25 years ago I had an accident and I lost my two front teeth. So a friend of mine who's a dentist, I went along to see him and he said, yeah, you're going to have dentures. I said, no, I don't want dentures. He said, well, we can make you this bridge, which basically involves grinding down the teeth at the side, making a cosmetic dental bridge and fitting it in. And that's what he did, and it's worked fine for 20 odd years. But then recently I've had an accident which meant the bridge became loose, and he checked it, dentist, and he said the roots are damaged. What we're going to have to do is take the bridge off, take the roots out, and then fit you with a big denture. And I said, I don't want a big denture. And he said, well, the alternative is to have dental implants. And he recommended I see what a friend of his, a very well renowned dental surgeon down south, and I went to see him, and this is what he did. He had a look round, he did an x-ray, he did an MRI scan, and he said, what I recommend is this: we put a dental implant in this side of your bone, in the jaw, a dental implant in that side of the jaw, where the two teeth are missing in the middle, have been missing for 20 years, the jawbone's receded, so I recommend that we put a big dental bone graft in there and thicken it all up. And I said, yeah, whatever you recommend. And treatment plan estimate there, and it spells out there exactly all the treatments I was going to have, and there's the price. I don't know if you can see it, about £7,500. About $10,000, I don't know. So I said, okay. He said, but when you come back, you give me a prescription. He said, take 3 grams of antibiotics before you come in here. He says, because we don't want you getting an infection. You know, it could ruin the treatment, and it could kill you. He says, gum infections can be very serious. I said, okay. So I took the 3 grams of antibiotics, went back to see him, had the anaesthetics. I didn't have a sedation. I had the anaesthetic. He cut all the way across at the top, put the bone graft in, went into the jaw. He's put a dental implant in there, into the jawbone, and he's put a dental implant in there, into the jawbone, and I can just feel the metalwork sticking out. Apparently that's normal. And then he dragged the gums down and he stitched it all up. 20 odd stitches. Now, this is what I look like after, but when I got home I took a photograph. This is what I look like. As you can see, I was quite swollen, but the next day I was even more swollen. My whole of my head was like a balloon. But the swelling wasn't too bad. The thing is, I couldn't eat properly. I couldn't drink properly. I had to just lie down in bed. I was in agony. It was as if the whole thing was inflamed or infected. Now, when he sent me home from the dentist, he said, I've got to take these antibiotics for a week to stop gum infection. He said 500 milligram of amoxicillin 3 times a day, 400 milligram of metronidazole for a week, and take them 3 times a day. Now, this is a guy who spent the last 25 years working on natural remedies. But I trusted them because the last thing I wanted to do was get a gum infection, you know, especially with all this stuff in. But after a few days, I was in agony. There was blood coming out between the stitches. There was like pus. So I went to see my local dentist again, my friend, and he said, "Oh, take this mouthwash stuff." That didn't do anything. I was in agony. He said, take this gel stuff. That didn't work. I went to the local supermarket to see what I could buy. I bought that stuff. They might be good products, but they did nothing to reduce the inflammation. I couldn't touch my gums. I couldn't put a denture in because the denture was touching the swollen gums, the gum infection. So I couldn't wear dentures, I couldn't go out the house. I just persevered. I even went back to see the local dentist. I said, I can't wear the denture, and he made me this. It's a gum shield with some teeth in the front. Makes me gag every time I put it in. But anyway, from a distance it looks like teeth, doesn't it? So it reduced the amount of pressure on the gums. It was better than a denture. But it makes me gag. I couldn't wear it. It cost me £200. So after a week, things weren't much better. So what am I going to do? I've had 3 lots of antibiotics. The dentist said, oh, it should be alright. But now listen to this. Nowhere on all this preparatory stuff about bone implants and treatment estimates and anaesthetics and placements, and nowhere in here does it mention the word implantitis. Now they're telling me I've got implantitis, and I said, what's implantitis? They said it's like a gum infection around your dental implants. So what am I going to do here? These are very well-meaning people, and presumably the surgery's done very well, but what am I going to do? Now, as I say, I make a living from natural remedies. 22 years ago, I've been seeing people on a regular basis, and I invented this product, or formulated this product, called Gum Doctor. Quite simple. It's designed to do 2 things. Reduce gum infection, which means it stops bleeding gums, it stops spongy gums, it stops receding gums, and it promotes healing. It just gives the body's natural system a boost. Now, you know and I know, drugs, toxic drugs, sometimes we've got to take them, but they don't give your own body's healing system a gentle nudge. They traumatise your system. My system has already now been traumatised with 3 lots of antibiotics. So this is what I did. Bear in mind I didn't have any dentures in at the time because I couldn't. My gums were infected. Gum Doctor is so easy to use. And I just... And at the time I could hardly touch my gums. And I massaged it all over the stitches, 20 odd stitches. I put the top on, and I sat back and I thought, am I imagining this? My gums started to feel better, and I thought, well, maybe it's an anaesthetic effect. Now, when I came up with Gum Doctor, I knew it was good for spongy gums, receding gums, gum infections and what have you. The last time I used this stuff was 15 years ago when I had bleeding gums. And I've given it to plenty of people since. I've sold tons of it on the internet, but I had no idea how good it was. I put some more on at night, and in the morning I woke up and I smiled because I could put my dentures in. No problem. I kept putting this stuff in. I even then just put a bit on the back of the denture, put it on. Within a few days I was back to normal. I could eat what I wanted, drink what I wanted. I can even eat chips and crisps and anything, nuts. Look, solid, no infection. That was from using my Gum Doctor remedy. Now, another 2 months' time, I've got to go back and they're going to take the screws off that are in, and then into the dental implants they're going to put me a bridge, and I'm going to be really happy. But if you've got a gum infection, then you need Gum Doctor, just as I did. You've seen how easy it is to apply. You just carry it with you, in your pocket, use it 3-4 times a day. Make sure you put it on at bedtime, because it's going to be in your mouth for 8 hours. And it's that good. There's no need course after course after course of antibiotics. By all means, take the antibiotics, but make sure you use the gum doctor. And go and discuss it with your dentist. The same guy who made me this is shocked at this. He now gives, when he does dental implants, he gives this to his clients along with his antibiotics. It's that good. It's that good for gum infection. If you've got a gum infection, get the gum doctor. Somewhere around this video, probably below it, but somewhere, is a link to a website. Now, it won't be one of the best, flashiest websites out there, but I guarantee it is the best gum infection remedy you will ever find. And if it doesn't work for you, click the button and get your money back. That's how. It's not even confident. I just know this works. You've seen what it's done for me. It'll do the same for your gums. And if you protect your gums, you won't lose your teeth. Alright. If there's any questions at all, drop me an email. But more importantly, get the gum doctor, get it on your gums and start looking after yourself. Alright, bye for now.